Alright, hi, I'm Alice. I'm going to be doing a newborn assessment today. The first thing I would do is put on hand sanitizer and clean gloves, and then I would identify the patient with two identifiers, their name and date of birth, and then I would check the baby's wristband with the mother's wristband to make sure that matched. And the last thing I would do is make sure the baby was in the warmer and the warmer is on, so the baby stays warm, and that all the side rails were up so the baby couldn't fall off. The first thing I'm going to be doing today is taking the baby's apical pulse for a full minute. I'm going to do that. Alright, for the baby's heart rate, I got 140, which is within the normal limits of 110 to 160. And the next thing I'm going to be doing is assessing the baby's respirations for a full minute as well, by looking at it, because you can see them breathing. Alright, for the baby's respirations, I got 40 respirations per minute, which is in the normal range from 30 to 60 respirations per minute. And then I'm going to be taking the baby's axillary temperature, which should be in between 36.5 and 37.5 degrees Celsius. Alright, the next thing I'm going to be doing is listening to the baby's heart rate, a heart in all four chambers, and making sure that's normal. Right? The heart has an equal rate and rhythm, and there is no presence of murmurs. And the next thing I'm going to be doing is listening to the baby's brachial, radial, and femoral pulses. Right? The brachial, radial, and femoral pulses are clear and equal bilaterally, which is good. And the next thing I'm going to be doing is listening to the baby's lung sounds anteriorly. Right? The baby's lung sounds are clear and equal bilaterally, and there is no presence of adventitious breath sounds or respiratory distress like grunting, retractions, or nasal flaring. And after I looked at the lung sounds, I'm going to be moving on to the baby's head and feeling for the anterior and posterior fontanelles. And I would feel in the front and then all the way through to the back. Alright. The anterior fontanelle is soft, flat, and diamond shaped, and the posterior fontanelle is soft, flat, and triangle shaped. The sutures are not overriding or distended, and upon observation, and the suture lines are approximated, and upon observation, there is no presence of molding, caput, or cephalohematoma on the baby's head. And after I looked at the head, I'm going to move down to the eyes, and upon observation, the eyes are equal and symmetrical. The sclera is white, and there's no presence of discharge on the eyes. And after I look at the eyes, I'm going to look at the ears and make sure that they are in line with the eyes. And I'm going to be checking the ears for instant recoil. And the baby has instant recoil. And after I look at the ears, I'm going to be looking at the nose. And I would make sure that the nares are patent. And after I look at the nares, I'm going to be moving to the mouth. And for the mouth, I would check the baby's sucking ability and make sure that the suck was strong. I would be making sure that the palate was formed so the baby could feed. And then I'm going to be checking for the rooting reflex, and you do that by rubbing either side of the baby's face, and they should turn their head to what side you're rubbing their face. After I check the mouth, I'm going to be moving to the clavicles. And I would just feel for the clavicles, like right here, make sure that they are equal bilaterally, they're symmetrical, and that there's no presence of crepitus, which would indicate that they might be broken during delivery. After that, I'm going to be observing the nipples and breast tissue. The nipples are present and equal bilaterally, which is good. And after I do that, I'm going to be listening to the baby's bowel sounds in all 4 quadrants. Right? Bowel sounds are present in all 4 quadrants, and upon palpation, the baby's stomach is soft and non-distended, and there's no presence of any distension or hernias. And then after that, I'm going to be looking at the baby's umbilical cord, and upon observation, the baby's umbilical cord is clean, dry, and intact. There's 2 arteries and 1 vessel, and the clamp is present. After that, I'm going to be looking at the upper and lower extremities, and I'm just going to be checking the range of motion by just rotating them like this, the upper and lower ones, and I'm just going to be checking how they bend. All right. So upon palpation, the baby's upper and lower extremities have a good range of motion. They are symmetrical, and they are devoid of any clicks and pops, which might indicate that they were broken during delivery. And the hands and feet all have 5 digits each, which is normal. And then I'm going to be looking at the baby's genitals, and since this is a female baby, I can see that the labia majora is covering the labia minora, and that the clitoris is midline, and no discharge is present. And there might be some discharge for female babies who are getting rid of their mother's hormones. All right, and the next thing I'm going to do is check some of the baby's reflexes. And the first one I'm going to check is the plantar grasp. And you do that by pressing like under the toes, and the toes should curl in like they're grabbing. And then I'm going to check the Babinski reflex by tickling the bottom of the baby's foot like that, and the toes would splay out like that. And then I'm going to check the palmar grasp, and I'm going to do that by just touching the palm, and the fingers should like grab my finger. All right? After that, I'm going to flip the baby over and check the spine. So I would feel all down the spine, and the spine is midline, and there's no presence of any dimples or openings or tufts of hair. And then I'm going to check the gluteal folds. All right, and upon observation, the gluteal folds are equal and symmetrical with each other. And then lastly, I'm going to look at the baby's skin. And the baby's skin is pink, dry, and intact. Some milia is present on the nose, which is going to go away. And some acrocyanosis is present on the hands and feet, which is normal after birth, but it should go away within a day. And lastly, there's a birthmark present on the upper thigh, about 2 millimeters big, which may go away or it may not. And the last thing I'm going to do is give the baby its medications. So the first medication I'm going to give the baby is vitamin K, and that's to help the baby's blood clot because it doesn't have its mother's clotting factors anymore. And I'm going to give vitamin K in the vastus lateralis at a 90-degree angle, and I would just check the MAR and make sure that there's an order for it, and I would scan the baby's wristband and the medicine, make sure it hasn't been given before, and then I would give the shot in its vastus lateralis. And the next medication I'm going to be giving the baby is erythromycin, which is an ointment that goes in the baby's eyelids to help protect the baby from conjunctivitis that can be given from the mom from an infection the mom has from vaginal delivery. And I would give that from the inner eyelid to the outer eyelid in both eyes. And lastly, I would assess the baby's kidney and GI function, and that's easy. You can just do that by making sure the baby's had a wet diaper and has had a bowel movement within the past day, 24 hours. And then I would take off my gloves, use hand sanitizer again, and I would probably give the baby back to its mom. And then that's it. That is my newborn assessment.